Some other forms of support include uh, having a multidisciplinary team, for example, a psychologist, to not necessarily give medications for, but I always ask patients, do you feel like you want to talk to somebody, a third party, objectively, about things that are on your mind, and that would talking about that help you? So I always offer that kind of support as a referral. Second of all, I think that finding local patient and support groups are extremely helpful because they meet other patients and they see that I'm not alone. And the caregivers also see and can exchange discussions and stories about the caregiver issues that they have with other people. And I think that when they talk to each other and say, I've been going through that as well. Oh, yes, that happened to you? Oh, yes, I've been feeling the same thing. I think that those kind of support groups are fantastic. And I always encourage patients to seek out support groups locally wherever they are available. And also, I also make sure that I make it clear that I'm available for them to talk as well, not just about the chemo and the science, but also if there are things on your mind. There's a lot of, particularly from the patient support side, there's a tremendous amount of caregiver guilt associated with taking care of these patients. And I'm happy to talk with the caregivers if they felt like they wanted to get certain things off their mind. And I think that being available in that way, I think is helpful to patients rather than saying, well, that's not my area, or I don't have time to talk about that. I'm more focused on your chemo. I think being available in that way gives them a peace of mind that there are options.